here with Dr. Shames again, and we're discussing kind of a change in the way we look at certain, I guess, medical treatment for folks with pain. And on September 16th, your team partnered with a whole bunch of other folks on a forum about how to deal with chronic pain. Tell us a little bit the summit, why you felt it was important, and why you really had the summit all together.
I probably need to go back a little while to give you the background on the summit. So we have more of our citizens dying of drug overdoses than motor vehicle accidents. That's true of Jackson County, it's true of the country as a whole. And it's really an epidemic problem. People dying of prescription opiate overdoses. And those numbers have really been kind of flat for 10 years now. And a lot of that has to do with sort of a change in thinking we had about 20 years ago about the concept of chronic pain. And we thought that people who had pain on a daily basis would benefit from opiates, painkillers, on a daily basis. It made sense if you think about it, because if you hurt yourself, you break a leg, you have surgery, and you take an opiate, it relieves your pain and you're better. But chronic pain is different than acute pain. Pain that lasts for years is different than pain that lasts for days. And the dependency, the tolerance, the drugs themselves produce a lot of unnecessary, unwanted side effects, including addiction and myriad problems that come with the drugs. So we've learned a lot over the last 20 years, and we've learned that there are lots of better ways to manage chronic pain rather than taking high doses of painkillers. So there's really a three-pronged approach for a community to change what it's doing. One is the prescribers have to learn what best practices currently are and adopt those practices and educate their patients. The patients need to understand what the docs are doing, and the patients probably need a different kind of support. If they were used to using pills, and now we're saying the pills aren't really good for you, the question is logically, well, what are you going to do for me? What's next? I shouldn't say do for me. What can you offer me to help me manage my pain? And then the third is the public at large. So this public meeting was around educating the public, people who have pain, people who are just curious, and we brought all sorts of resources together, people who have pain, people who treat with non-opioid treatments for pain, and just an educational opportunity. And it was very successful. Lots of people showed up, and I think we all learned something from it.
So I know that my wife deals with chronic pain on a regular basis, and I know that she was probably felt the best when she was going through some pretty good physical therapy and exercise. So tell me a little bit about some of the other kind of things that are out there that help people get through chronic pain.
Right. We have within ourselves some real healing powers. We have substances we release, which are very similar to opioids, called endorphins, and there's lots of things we can do that can release them. Exercise is an excellent example. One of the reasons some people run every day is it just makes them feel better. Not only is it good for their cardiovascular system. So if you rely on pills and you get into a very sedentary place, and you find that you can't stop taking the pills because you go through physical withdrawal and it makes you feel really bad, often you aren't able to, and you aren't doing the things that can be naturally helpful. You mentioned exercise, stretching exercises, sometimes just understanding the nature of pain. Sometimes just saying, you know what, I'm not going to let this pain take my life over. I'm going to manage this pain. I'm going to work with this pain. I'm going to try and turn a negative into a positive. Learning about your thoughts and your feelings and your emotions that are all tied up in pain. And maybe when you separate those out, the pain doesn't look so bad after a while.
What are some of the things that people can do to make sure that they're using the drug and not misusing the opiate drugs?
Well, some of that has to do with judgment by their healthcare provider. And so, often your healthcare provider will say, I want you to do this, and most people do that. So you may want to just double check that your provider is, you may ask questions about the medicines, how long can I take them, should I take them this length of time, just sort of be an advocate for your own health care. If the person is using the medications to excess, they run out early, They seem to be overly obsessed with the medicine. You know, where's my next pill coming from? I better make sure I have this. Certainly if they're using other people's meds, if they're combining the drugs with sedative substances like tranquilizers or alcohol, those are all worrisome signs, because you get into trouble when you take, you know, more than the usual amount, and you combine it with other sedative drugs. You can get to the place where you just stop breathing. So I mean, that's how you ultimately die of an opiate overdose. It just suppresses your ability to breathe, and you don't wake up. I would say if you are more functional than you were, if you want to be able to walk the dog, lift the grandkids, go to work, go fishing, and you couldn't do those things before you took opiates, and you can now, I'd say it sounds like it's working for you. If in fact you're still sitting on the couch and you're still groaning in pain and you're not doing stuff, then I'd say it doesn't look like that drug's working for you. You're taking a whole lot of risk and you're getting hardly any benefit. It's a very complex situation, so you are going to have to talk to your healthcare provider, and you're probably going to need other help. You're going to need some behavioral support, some movement support. You might need some peer-to-peer support, where you periodically get together with other people who have pain to sort of share successes that they've had.
So I know one of the kind of, I guess, community side effects of the opiate addictions that are out there is really the street is starting to supply this, and law enforcement is having to deal with it. Are you seeing that more and more? Are you working with the folks in law enforcement so they really understand what to look for and what's happening on the streets?
We are awash in opioids. We have pills everywhere. You know, kids, people that are looking for them can easily find them. And as we tighten up, as we get controls and we prescribe less and people misuse them less, heroin is cheap. And unfortunately, heroin use is on the rise as opioid prescription abuse is declining. We work very closely with law enforcement. We have meetings with them on a monthly basis, and they've come to our Oregon Pain Guidance Group, the OPG, and I think we have some really excellent work we're doing together. We're hoping law enforcement, especially the Medford Police Department, will start carrying naloxone, the overdose antidote. They may be carrying that in their patrol cars soon, so that they can reverse an overdose if they come across one.
So you mentioned the Oregon Pain Guidance Group, yes. So that started with Oregon, not Southern Oregon, which is great. So tell us a little bit about this effort in this group.
Sure. So as I mentioned earlier, we need to educate healthcare providers about the best practices around prescribing opioids. Their patients need additional supports, and the public needs to understand. So we've been meeting for years now, 3 years plus, as a group of prescribers and insurance carriers and people from the emergency room, substance abuse counselors, mental health, hospitals, to basically say, how do we solve this problem as a community? What is Southern Oregon going to do about this? And we've created a book, the OPG guidelines. We have a website, which I would definitely encourage people to check out, because we have a portal for the public on it. It's www.oregonpainguidance.org.
Well, thank you so much for taking on such an important thing in our community. I know that I think everybody is touched by somebody who's dealing with chronic pain. Yeah,
everybody is. That's
whether
right.
The young and old and athletes, and
sure,
it's
part of being alive.
Yeah.
And the older you get, the more pain you're going to have.